Avinash, one of the mentor at StudyMBBS StudyMRCOG group. In this video module, as a course of Introduction to MBBS at StudyMBBS group, we will be discussing on the topic changes in NMC curriculum. Now, what is the curriculum? Curriculum means it is made up of the syllabus, that is the content that you are going to study, and also the learning opportunities that you will get with respect to the teaching learning methods that are implemented, the infrastructure that is provided, and the assessments that are conducted. Together forms a curriculum. Syllabus is just a content. Now the curriculum timeline, if we say, earlier the NMC was called as MCI, Medical Council of India, and it was rechristened as National Medical Council NMC, and the statutory regulatory body that it is, which prescribes the guidelines for conduction of the MBBS, postgraduate and super specialties in medicine and surgery and other subjects in our country India, has formed many guidelines, and these guidelines were introduced first at 1997. As you can see, it was introduced first at the 1997. Later, because we had to integrate ourselves into international curriculums and be recognized elsewhere throughout the world, it was decided to upgrade our curriculum, and a competency based curriculum medical education was introduced in the curriculum at 2020. Around 2099 it started, and it was introduced by 2020, and to this effect a graduate medical education regulation of 2021 was introduced, and then there were several amendments around 2023 and afterwards, and now a competency based medical education 2024 guideline is at present. Now we will see what are the changes. This competency based medical education curriculum is based on the national goals, and we should have particular university or institutional goals, and the role of the intermediate medical graduate is clearly given. That is a learner goal: to be a clinician, to be a communicator, to be a lifelong learner and a leader and a good professional. All these qualities should be imbibed. And this competency based medical education, it helps to tell them this, that the doctor should be able to, at the end of this, understand and provide not only preventive care, promotive, curative and palliative holistic care with compassion. This is what is expected of a Indian medical graduate. There are overall around 19 subjects they will be studying throughout their MBBS course, and it was said teaching learning curriculum can be taught in a bilingual mode. The universities shall not register any student who are admitted beyond any set date. That is prescribed, and the course is for around 4.5 years, divided into 4 professional years, and we will see how it is divided, and at least 39 weeks per year and at least 39 hours per week the course runs, and more than 1/3 of the teaching, it was prescribed that it should be a large group lecture based teaching, that is less than 1/3, and more than 2/3 of this teaching should be small group, that is in terms of small group discussions, practicals, demonstrations and performance, interactive sessions, case based learnings, tutorials, self directed teachings, clinical postings, etc. in small groups is encouraged. Now the learning process in this curriculum encompassed exposing themselves to various clinical experience in clinical postings, solving the cases using problem-oriented approach, case studies, case presentations, visiting community healthcare activities. And also one needed to maintain the logbook and portfolio, which is now mandatory. Various teaching learning methods included via early clinical exposure, problem-based learning, case-based learning, self-directed learning, integrated learning, and learning through our own experiences and subjecting ourselves to community and learning the subject of interest using electives. These are various TL methods, and it was prescribed that the course should be aligned and integrated both vertically and horizontally. You will see what it is. This is the prescribed logbook format. The change which was earlier not there, now it is present. So you can see the competencies that are assessed and the name of the activity to be written, the date of completion, the attempt, whether it is first or remedial attempt or a repeat attempt, and the rating given by the assessor, that is a facilitator, is it below or meets or exceeds the expectations, and the decision to complete or repeat or give remedial, and the signatures. And this should be recorded separately for each subject and also for foundation course and others as is prescribed here. Now key changes included, there is a yearly main exam which is followed by supplementary within 6 to 8 weeks. Earlier it was not there. Now student who fails in supplementary exam in any phase, the students goes to the junior batch for teaching learning. There is no supplementary batches, odd batches are not there. Candidate who is not appeared for university examination for a subject, it shall not be counted as an attempt if they don't appear for both. If you appear for one and not appear for others, then it will be counted as an attempt, one attempt, partial attendance. Okay. Now, no more than 4 attempts are allowed for a candidate to pass phase 1 examination. The total period for successful completion of phase 1 is 4 years. And the learner is not entitled to be graduate if he takes more than 10 years after joining the MBBS course, including the continuous rotatory internship. That is the last 1.5 years, last 1 year. And then he will not be given MBBS degree. So to pass first phase, maximum is 4 attempts, maximum is 4 years, and to pass overall MBBS, maximum is 10 years including internship. Then who fails in phase 1 exam, what they do? They will not be allowed to join the phase 2 until he passes all subjects of the phase 1, either in the regular or supplementary. Once he fails in regular, then he can write the supplementary. If he passes, he can continue in the second phase. If he fails supplementary, he has to be detained. Now, who fails in phase 2 exams, they will be allowed to join the phase 3 part 1 exam. So you can see there is phase 1 exam, there is a phase 2 exam, there is a phase 3 part 1 exam, and there is a phase 3 part 2 exam, main summative exams. There are 4 exams after phase 1, then phase 2, and then phase 3 part 1, and then phase 3 part 2. Now those who fails in phase 2 are allowed to go to phase 3 part 1. But they are allowed to write phase 3 part 1 only after they clear the phase 2 and be eligible to write phase 3 part 1. Similarly, those who fails in phase 3 part 1 are allowed to go to phase 3 part 2, but they are allowed to write phase 3 part 2 only if they clear all the subjects of the previous phase 3 part 1 and are eligible to write the phase 3 part 2. This is the timetable. So you can see the phase 1, phase 1 is having 12 months. Now around August, if the admission starts, from September onwards the teaching starts, and by July it will end next year. 12 months. At that around 12 months there is an exam. Okay, once they pass, Then next 12 months is phase 2. Okay, around September it starts till July it runs, and in again next year August phase 2 exam will be there, 12 months. Then phase 3 part 1 is again for 12 months. Again September the course starts, phase 3 it runs till July, and in August they will have phase 3 part 1 exam, again 12 months duration. Whereas phase 3 part 2 is of 18 months. It starts at September, it runs throughout the next year, then after the next year around January it will complete, and February they will give phase 3 part 2 exam, and that is called as the first step of next exam, NEXT exam, first step of the next exam. After this 18 months they will have 1 year compulsory rotatory internship. It is for again 12 months, and at the 12th month there is the proposed next part 2, step 2 of the next exam, NEXT exam. Okay, so phase 1 12 months, phase 2 12 months, phase 3 part 1 12 months, and phase 3 part 3 18 months, and internship of 12 months. So around 4.5 plus 1, 5.5 year course is the MBBS. This is the timetable and distribution. And in phase 1, which are the subjects that are learnt? That is, the main subjects are this anatomy and physiology, and biochemistry. Along with that, you can see that the introduction to community medicine, including conduction of family adoption program, is carried out, and there are be sent to hospitals for early clinical exposure, and a module of attitude and communication and pandemic module is also there. The first 2 weeks will be foundation course. First 2 weeks will be foundation course. This is the phase 1. Whereas in phase 2, they have 3 main subjects for which they give exam: pathology, microbiology, and pharmacology. However, the other subjects are also continued to taught. That is a forensic medicine and toxicology, and introduction to clinical subjects. That is, the clinical postings will start. Family adoption program will continue. AdCom will continue. In phase 3, these main subjects are community medicine, forensic medicine, okay, ophthalmology, and ENT, for which they will be giving exams. ENT, ophtho, community medicine, and forensic medicine, they will give exams. And the AdCom and clinical postings and the lectures on the medicine, surgery, pediatrics, OBG will continue. Whereas in phase 3 part 2, main subjects are medicine, allied subjects like dermatology, psychiatry, pediatrics, then surgery, allied subjects like orthopedics, radiodiagnosis, anesthesiology, and obstetric and gynecology. These are the main subjects for which they will give the exams, along with which there will be clinical postings, and an AdCom module, that is attitude and communication module, will run parallelly. So in first year, anatomy, physiology, and biochemistry are the main subjects. First 2 weeks there will be foundation course, and ECE will be there. Subjects are taught in alignment, that is, similar topics are taught in anatomy, physiology, and biochemistry together. Also, relevance to the higher subjects are also introduced with respect to integration and cases. 2 weeks of vacation, 2 weeks of public holiday, and 9 weeks to conduct all other exams, including results, are also considered in this 52 weeks. Overall, we get only 39 weeks, and around 39 hours per week amounts to 1521 hours, including all the 3 subjects. Later, there will be university exam. If they fail within 6 to 8 weeks, there will be supplementary exam, including results. In foundation course, that is the first 2 weeks of starting of the first MBBS course, they will be taught regarding the orientation to the subject and introduction to what skills they have to learn, orientation to community, orientation to professionalism, language, computer skills, sports, and extracurricular activities. These many orientations are given during the foundation course, around 80 hours, 2 weeks at the start of the course. Attendance is compulsory here also. Now, what is the distribution of subject-wise teaching hours? Foundation course around 80 hours, anatomy around 620 hours, physiology around 445 hours, biochemistry around 249 hours, and some hours for exposing the student to clinical subjects, that is hospitals, early clinical exposure, and introduction to community medicine, family adoption program, ADCOM, and sports and curricular activities. All in all, around 1521 hours are distributed. And less than 1/3 is large group teaching, and more than 2/3 is the small group teaching, with sessions particularly given for self-directed learning. Now, coming to phase 2, around 12 months duration, 39 weeks out of the 52 weeks available are for teaching, and around 39 hours per week includes 1521 hours. Main subjects are pathology, pharmacology, and microbiology. Along with it, the other subjects, clinical subjects like medicine, surgery, OBG, forensic medicine are also taught, introduced. Of course, family visit to community medicine continues, and there is a pandemic module which is continuing, and ADCOM module and family adoption continues parallelly like in first year. Subjects are taught again with respect to alignment and reintegration and simulation based learning. 2 weeks of vacation, 2 weeks of public holidays, and 9 weeks of all exams and for exams and results are included in this 52 weeks. Once they raise the university exam, if they fail, they will give an option to write supplementary exam in next 6 to 8 weeks, including the results. Now in phase 2, you can see pathology has 260 hours, pharmacology has around 260 hours, microbiology has 228 hours, and the introduction to community medicine have lesser duration, and the clinical subjects, medicine and surgery, have 600 hours introduction. Of course, exams are not there. It is there only for pathology, pharmacology, and microbiology. So total around 1521 hours of teaching is there, and the concepts is similar to phase 1. Now clinical postings start in second year. That means students starts to go to hospitals for around 3 hours per day, Monday to Friday, and there will be 15 hours per week for all clinical postings in second year itself. Time is also given for sports, yoga, and extracurricular activities. Now in phase 3, part 1, which is for 12 months and similar duration of hours, main subjects are community medicine, ENT, ophtho, and forensic medicine. Along with which, the other subjects, medicine and allied subjects like pediatrics, psychiatry, surgery, ortho, and anesthesia, OBG, radiology are also continued to taught from where they left at second phase. Similarly, 2 weeks of vacation, 2 weeks of public holiday, 9 weeks are considered for all the other internal exams and university exams and giving the results. And also, at the end of the university exam, immediately electives of 15 days will start. Therein, they are asked to choose an elective subject in which they can rigorously undergo special training or complete a task. The first block is 15 days immediately after the exams of third phase, part 1, 12 months. Now these are the durations. So you can see major durations is for the forensic, for which they are going to give exams, community medicine, ENT, and ophthalmology. And clinical postings again continues in phase 3, part 1, wherein they continue to learn again similar to 3 hours per day, but there will be 18 hours here per week minimum. And the other subjects, medicine, surgery, and OBG clinical subjects are continued to taught. but there is no exam. Now phase 3 part 2 is for 18 months. So 62 out of 78 weeks are available for teaching, and around 39 hours per week includes 2418 hours of teaching. Main subjects for which they are going to give exams are medicine and allied subjects, surgery and allied subjects, OBG and pediatrics. Here at the start of the third phase part 2, second block of the electives of 15 days will start. And again here 3 weeks of vacation are considered, 3 total weeks for public holidays and 10 weeks to conduct all the other exams including results. Excuse me. And you can see the highest amount of hours is for medicine, surgery, OBG, pediatrics, orthopedics, which exams they are giving, allied subjects, dermatology, psychiatry, radiodiagnosis and anesthesiology, and clinical postings are more. So at least again 3 hours per day, around 18 hours per week. The extra hours may be used for preparation of NEXT or self-directed learning components. Now, clinical postings, which they start around phase 2, that is the second year onwards, and it continues in phase 3 part 1, that is another 12 months, and it continues in phase 3 part 2, another 18 months. So these are the training weeks, around 36 weeks in second year, 36 weeks in third phase part 1, and 62 weeks of clinical postings will be there in third phase part 2. So total 134 weeks of clinical postings are there. So you can see there is part 1 clinical posting, that is first clinical posting in phase 2, second clinical posting in phase 3 part 1, and third clinical posting in phase 3 part 2 for main subjects: general medicine, general surgery, OBG, pediatrics. So all of them are having 3 clinical postings, these main subjects: medicine, surgery, OBG and pediatrics. So these are the first, second and third postings. Whereas electives, there will be only one in third phase part 1, around for 15 days block, 2 blocks, 1 month. Community medicine will end at third phase part 1. Now the allied subjects and also ophthalmology, ENT and community medicine, these 3: ophthalmology, ENT, ophthalmology, these will end at third phase part 1, will not be there in third phase part 2 postings. Whereas the allied subjects, the others like orthopedics will be 2 postings, psychiatry will be 2 postings in third phase, and radiodiagnosis and dermatology and anesthesiology, they will be only 1 posting, minor postings in third phase part 2. Now the curriculum introduces the students to learner doctor program. What is it is? A learner will be learning to become a doctor. In phase 1, how it is done? Through early clinical exposure. Taking the students to hospital, observing, asking them to observe clinical correlation and basic science correlation. Understanding the perspective of illness, and by conducting the family adoption program. They will be visiting families, adopting minimum 3 families, at least 3 to 5 visits. That is how they learn in phase 1. Whereas in phase 2, they will have first clinical posting, in which they learn history taking, doing physical examination, and noting the change in clinical status, learning to communicate with the patient and educating them, and of course continue with the family adoption program. Whereas in phase 3, there is a second clinical posting starts. Along with the above that is learned in phase 2, they will learn to select the investigations and basic procedures and how to continue the management care. Whereas in the last phase 3 part 2, all of the above is done along with learning to make the decision, management and outcome. except the family adoption program stops at third phase part 1. This is how the learner doctor program progresses sequentially. And of course, the compulsory rotatory internship afterwards. Now this competency based medical education, we need to understand what is competency. Competency means it is a defined set of context specific with respect to healthcare here. Either knowledge, skill, behavior and judgment that a learner must explicitly demonstrate to effectively perform a particular task in a professional setting, particularly healthcare. And these should be observable and measurable. And they are achieved progressively through the milestones in first year, second year, third year and internship. So they are context specific knowledge, skills and behavior which are observable, which the student is able to demonstrate. For example, in the clinical skills, the competency may be ability to perform a physical examination, a context specific demonstration of the knowledge, skill and communication, which is observable and measurable either by assessment of the skills. Similarly, in the skills of communication, you should be able to effectively communicate, diagnose and treat the options to patients, give the treatment options to patients. In a professionalism competency, it should be demonstrate sensitivity towards diversity and patient needs. The expected competency in clinical reasoning, probably to develop differential diagnosis based on clinical evidence. These are the examples of the competencies. Now, there are competencies which are prescribed to each subject. So you can see each subject has particular number of topics and particular number of competencies. So around, you can see that in phase 1 and phase 2, around more than 1100 competencies are there. Each subject having different competencies, number of competencies. Similarly, the medicine and allied subjects have around 1100 competencies. Okay. Similarly, surgery and allied subjects also have around 500 competencies, which the student is subjected to meet. That is, this is the minimum acceptable standard criteria is set, and these competencies must be learnt by the student. Now, amongst these competencies, there are certain skills or competencies which the students must get certified for effective completion. Around in phase 1, there are 18 to 22 certifiable skills, and in phase 2, around 24 to 32 certifiable skills, and in phase 3, 50 to 70 certifiable skills are there, including part 1 and part 2. So you can see in human anatomy, majorly 4 to 5, and physiology 5 to 7, and biochemistry 4 to 6. Now it changes, the number of certifiable skills changes. You can include more also in particular institutes, and the list will be given in the particular universities. Similarly, in phase 2 also, you can see all the subjects have particular certifiable skills, minimum acceptable standards that is set, and they need to be certified to be eligible to write the exams of that particular phase. Similarly, in phase 3 also, there are several certifiable skills in each subject. Now, the ATCOM module, which was earlier not there in traditional curriculum, was introduced here. ATCOM means attitude, ethics and communication. This is introduced so that the doctor develops all these qualities. Now, this is parallelly running in all the phases, and there are several modules, as you can see, divided for the ease of conduct into different subjects. There are around 4.9 competencies earlier, and it is distributed in phase 1. They will learn 2 competencies, that is how to communicate, what are the professional qualities, role of the physician, etc. are all learnt in phase 1. In phase 2, the other modules are learnt in microbiology, pharmacology and pathology, and in phase 3 and phase 4 also the other modules are learnt. So you can see it's a parallelly running module along with the pandemic module, which is another module the NMC has introduced after the pandemic of COVID. Now this is the marks distribution. So each phase there is anatomy, physiology, biochemistry. You can see they all are having two papers of 100 marks each. Theory. Total 200 marks theory for each subject and 100 marks practicals. In phase 2, again pathology, microbiology and pharmacology, 100 marks each of 2 theory papers, 200 marks for theory and 100 marks for practical. Whereas in phase 3, part 1, forensic medicine, they have 1 paper theory and 1 practical. Community medicine, they have 2 papers of theory, 200, 100 and 100, 200 marks and 100 marks practical. And otolaryngology and ophthalmology, ENT and ophtho, one paper each of 100 marks and practical of 100 marks. Whereas in phase 3, part 2, medicine has 2 papers, theory and practical 1. Surgery and allied subjects have 2 papers, theory and practical 1. Obstetrics has 2 papers, theory and practical 1, and pediatrics has 1 papers, theory and practical 1, each of 100 marks. The minimum marks that they should be able to acquire to pass is at least 40% in theory and practical. Overall combined, when you do the theory and practical, it should be 50%. If there are 2 papers, 40% includes 40% marks, combined 2 papers. And medicine and allied paper 2 will have allied subjects, psychiatry, dermatology and other questions. Whereas surgery and allied paper 2 will have, along with surgery, orthopedics, anesthesia and radiodiagnosis questions also. These are the allied subjects, along with AdCom questions. Now this is the suggested format for asking the questions in theories. At least 1 long essay question. So you can see scenario based, case based questions, MCQs will be there, at least 10 to 20. 1 long essay question, in that at least 1 will be case based learning, and at least 5 reasoning and short notes questions, and another 3 marks questions are there. So these are the distribution of the marks. MCQs, long essays, short answers and short essays. 1 mark, 3 mark, 5 mark and 10 mark questions. Reasoning based questions, clinical based questions, scenario based questions. And at least 35%, more than 35% of the total questions checks the higher order learning skills. And around 60% of the questions in the theory paper will check the lower order skills. That is checking memory and understanding. Whereas reasoning and analysis is taught at least 35%. Checked, assessed at least 35%. Now a concept of alignment and integration is introduced. As you can see, anatomy, whatever similar subject is there, topic is integrated with physiology in these particular and biochemistry in these particular topics. Similarly, this particular topic of general embryology is integrated with physiology and anatomy, biochemistry of these topics. So you can see such similar topics are taught together, and an extensive list of similar aligned topics are given, and this goes along across the phases. And there is an integration also. That means the relevancy of the biochemistry subject is taught by showing us the case of medicine. So higher subjects relevancy is shown in the first year itself. Similarly, when they go to second year, the basics of biochemistry are also again reinforced while learning medicine, second or third year. So this is vertical integration. Now when similar subjects are taught in the same year, that is horizontal alignment, horizontal integration, also called as alignment. So in this concept, was introduced in this new curriculum, teaching based on the principles of alignment and integration. So, to summarize, the major changes is earlier it was teacher centered, now it is more student centered. Earlier, the syllabus and content focused information gathering was there. Now it is problem based learning is encouraged. Problem solving is encouraged. Earlier, isolated study disciplines and subject based teaching were done. Now, aligned and integrated interdisciplinary learning is encouraged. Earlier, the learning was hospital oriented, but now it is community oriented. There were fixed and rigid set of subjects earlier. Now electives are made available in third phase part 1. Earlier it was apprenticeship based model. That means based on the exposure to the type of teacher and the student, the learning happened. But now it is systematic. Equal, similar learning opportunities are provided to all, and minimum acceptable standard to be passed is defined. This is the SPICES model, which is now followed in the competency-based medical education curriculum, which was earlier not there. Now, earlier teachers were there, which were actively participating in designing the curriculum and what is the content of teaching, which method to teach. All these teachers had the upper hand. Now, the learners are highly involved in designing the curriculum, what the content to teach, what are the methods, okay, and self-directed learning is highly encouraged. This is student oriented. A new curriculum, CBME encourages all this, and there will be more formative assessment than summative. What is this? Now, summative assessments are the end of the postings or end of the year exams, where there is assessment of learning and there is no feedback, only pass, fail, selection to interview, grading is given. Stakes are very high, usually 1, and number of assessors are also less. Whereas formative assessment is assessment for learning, which takes place across and along longitudinally throughout the course, and timely feedback is given immediately after that, and opportunity to improve is also provided. What the student has done correctly, not done, how to improve. The stakes are low because it is assessment for learning, can be conducted multiple times by multiple assessors, and different assessment techniques are used each time. This is what is encouraged now. At 20% of the internal assessment is also given to formative assessment, is considered for that to be eligible to write the exam. And self-directed learning is promoted in present curriculum. The students are encouraged to define their own learning issues, assess their own learning issues or problems or cases, find what objectives they need to learn, find what are the learning resources and opportunities, do the self-learning, come back and reflect upon this learning, and self-assess and revisit unresolved problems and repeat the cycle. This is encouraged in present curriculum. Now, to know what is the eligibility to appear for exams, there are 3 eligibilities. One is the attendance, second one is the internal assessment, and third one is the certification of competencies. Now, minimum attendance he should be having is 75% in theory and 80% in the practicals to be eligible, and 75% if the ADCOM module is running, and 75% if there are electives, and 80% in family adoption and each clinical posting that they undergo if they are there in that particular phase. Otherwise, they will be considered not eligible to write the exam, final exam. Minimum internal assessment that they should score to be eligible is 40% in theory, 40% in practical, and total 50%. Such minimum 3 internal assessments are conducted, average of which is taken for giving the internal assessment for theory and practicals. And several continuous periodic class tests are also conducted as assessments, formative assessments. 20% of the overall internal assessments can be considered from the formative assessments. And for the internal assessment, professionalism, attitude, communication, and other skills also can be considered in certain percentage. And also, to be eligible, students should be completed all the certification skills. These are the 3 eligibility criteria. And to declare as pass in university exam, he should score at least 40% in theory, 40% in practical, and total 50% in theory and practical included. If there are 2 papers, it is combined 40% he should be able to score. This is the pass criteria to go to the next year in the university summative exams. And attendance, internal assessment, and certification of completion of the certification of competencies is the eligibility to appear for the exams. Now, during the course, the student should be complete the eligibility. If not, we can give remediation during regular classes for attendance shortage, but not in extra classes. Still not meeting the criteria, then they will be detained and may be offered to appear in in the supplementary exam. Only if the initial attendance was 60%, not less than that. But if they don't meet any of this, then they will be detained to appear in regular university exams of that particular batch. So the key components that are introduced in new CBME curriculum for the NMBBS is introduction of foundation program for the first 2 weeks, parallelly learning attitude and communication module in all the phases, and the pandemic module in all the phases, family adoption program wherein the students are required to adopt 3 to 5 families in each year up to 3rd phase part 1, early clinical exposure in phase 1, and small group teachings more than 2/3 in all the phases, encouraging self-directed learning in all the phases, giving a problem-based learning approach rather than the context-based, content-based learning approach in all the phases, encouraging case solving and case-based learning, and the assessment is more objective, encouraged to perform OSPI, OSCE. Students required to maintain the logbook, chronicling the completion of the tasks. Electives of 1 month in 2 blocks around 3rd first part 1. Introduction of alignment and integration based learning, and the modification of the pass criteria and the eligibility criteria with respect to attendance, internal assessment, and introduction of more formative assessment components and the completion of the certifiable skills are the key components that are the major changes in the NMC curriculum for MBBS. And this curriculum is needs based, nations and students needs based, based on which competencies were designed, based on which specific learning objectives of the students at the end of which they should be able to perform were derived, based on which type of teaching learning methods are given, based on which type of assessment methods are selected, a feedback is given, and the overall program is evaluated. This is the needs based, competency based medical education curriculum introduced as a change at present. Thank you.